Hello, I'm Mike Larson, and I'm an abdominal radiology doctor at the University of California, Davis Health, and I'm leading a project to do surgery through a needle to fix abdominal wall hernias. Kind of explain what abdominal wall hernias are. I have this 3D printed belly button of and belly, but actually underneath the skin, we can see there's muscle and a little bit of this orange stuff, which is fat that is herniated from between the muscles um, out where it shouldn't be. So normally these hernias are just kind of annoying lumps that don't do anything. Occasionally they can be painful if the fat gets pinched or trapped. But what really makes hernias dangerous is when bowel, this pink stuff, makes its way up through that hole into the hernia sac. And that's when it can be complicated when bowel gets trapped, cutting off blood supply, causing major problems or even death if not treated. The current treatment for abdominal wall hernias is basically to see the hernia or visualize the hernia, whether cutting the overlying skin, as shown in this picture, or making a few smaller incisions on the sides, and then placing laparoscopes to look from the inside. Then reduce the hernia or move the tissue back into its appropriate place. Sometimes if the underlying tissue sac, leftover tissue sac is large enough, the surgeon will trim away the redundant tissue folds before sewing up the hernia hole or the hernia defect. That procedure would be called hernioplasty. Or they will directly sew up the hernia hole if there's not a lot of redundant tissue, which is a procedure called herniorrhaphy. These repairs are sometimes done with a mesh, sometimes done with just sutures. Then the skin is sewn up and done. The hernia is repaired. But the recovery time for healing is on the order of weeks. There are a handful of complications, maybe 3 to 4% will need a minor treatment. Then there are the costs, lots of costs. And then there are long-term risks of hernia recurrence, where the hernia just comes back. So here's some recent data showing that hernia recurrence isn't all that common in many instances. Here's 4 charts showing various repair techniques and levels of expertise. You can see most of these are less than 3 to 4% recurrence rate over 4 years if this is the first hernia repair. Primary in this case means first repair. Things are a little different if you have a recurrence. So this is a different paper and they flipped the graph. So if you have a recurrence of a hernia and then have that second hernia repaired, chances are within 6 years you'll have a third hernia. Half, yes, 50% of mesh repairs fail within 66 months and the hernia comes back. I am a radiology doctor, meaning I have extensive training using ultrasound and CT to evaluate anatomy, including having to evaluate hernias or lumps that are suspected to be hernias. And I have added training and experience using ultrasound and CT to guide needles into tricky places throughout the body. Because ultrasound can be used to see hernias and then temporarily push them back in or reduce them, all without radiation like with CT or without big fancy expensive magnets like with MRI, ultrasound is the frontline tool for examining hernias. These are some ultrasound pictures of a hernia. I've added some yellow lines to help make the hernia easier to see. And I also like ultrasound because we can see major blood flow using physics instead of having to give IV contrast like with CT or MRI. So ultrasound is also the frontline tool for guiding a needle into target tissue. Like when a nurse is struggling to find a vein, they can use the ultrasound, or in my case, when somebody needs tissue biopsied or a deep tumor biopsied or a pocket of fluid drain, I've driven a needle or supervised junior doctors driving a needle into well over 1,000 patients. And it turns out that there's some pediatric surgeons that have joined these two concepts of ultrasound being great to diagnose hernias and temporarily push the hernias back into place. And they put that in or married that idea to using ultrasound to guide a needle and suture. And they've been able to show that you can actually fix certain hernias in certain patients using their technique. Have an approved study at UC Davis to copy or slightly modify the pediatric surgeon's ultrasound hernia repair technique that would expand it to different types of hernias and expand it into larger into adults using barbed suture, also called knotless suture. There's a close-up picture of barbed suture on the right. So I'll be using ultrasound to guide a curved hollow needle to place this barbed suture to perform herniorrhaphy in certain patients with certain hernia characteristics. On the left is that picture of the hernia I showed earlier with the yellow outlining the hernia. And then superimposed is the proposed needle trajectories in dashed purple lines that I'll be doing. This is the general overview of the parts of my study. So before doing anything, we have a screening visit to discuss this in lots of details and confirm that you would be eligible, you or a loved one that has a hernia, and also to go over a consent form and make some measurements. The big procedure, the procedure day, it's actually an outpatient procedure that should only require about 4 hours of time, and 2 of that is for post-procedural monitoring, just to make sure everything goes as expected. And then because this is we have to monitor safety, make sure this is working and that hernias aren't recurring quickly. There'll be follow-up visits in person. And so you are aware here are the specific criteria that have to be met in order for you to take part in my study. So you have to be an English-speaking adult with a abdominal wall hernia or diastasis recti under approximately 8 centimeters. And then the exclusion criteria are in the middle, meaning if you have one of these, you can't be in the study. I'm certainly happy to talk with you because as a physician, I can offer novel procedures that have a reasonable chance of helping patients. I just couldn't necessarily reimburse you for your time as part of the study. Yes, thanks to the generosity of the American Röntgenray Society or Professional Radiology Society, I've been awarded a small grant so I can reimburse patients a little bit to cover their insurance copays and parking and kind of reimburse your time for taking on this novel study if you meet the study criteria. So thank you for your time. On the screen is my contact information if you'd like to get in touch with me to learn more for yourself or for a loved one that may have a hernia who is not able or willing to undergo general surgery to have your hernia repaired. Thank you again.